So yes, good evening, Bhumika, Shiv, Mehfooz, Angel, Garima. I hope the audio and visuals are perfectly fine. I hope the audio and visuals are perfectly fine. Just give me a thumbs up in the chat box if the audio visuals are perfectly fine. Nikinda Reddy, good evening. Yes, Ishan, good evening. Anjali, good evening. Thunder, good evening. Good evening. Yeah, Sadan Mansoori, good evening. Hmm. Abhi, good evening. Good evening. Hmm. Audio visuals of I think it's perfectly fine, right? So let's start with the class. Yeah. Pavan, hi. Yeah. Let's Preeti, good evening. Good evening. Let's start with today's class. We have already discussed the bones, the osteology of the clavicle. We have started. We have discussed the parts of the clavicle, right? We have discussed the parts of the clavicle. Hmm. Archana, Mohammed Siddiq, Pavan, Yayana, good evening. Mehfooz, okay. Now, we have discussed this chart in the last class, right? We have discussed the parts of the clavicle, okay, in detail, guys, right? Now, let's start with yes, more attachments, guys, over here. Okay, so yes, good evening, Namita Yadav. Hmm, Start. First, put the heading as peculiarities of the clavicle. Now we have already discussed the parts of the clavicle. Now let us discuss about the peculiarities or some special features regarding the clavicle bone. Some special features regarding the clavicle bone. Wait. Okay, good evening. So let's start with the class. Right. Peculiarities of the clavicle. Only long bone. Nitin, good evening. That lies horizontally. Only long bone that lies horizontally. It is subcutaneous throughout. Okay, now when I say subcutaneous, you can easily feel the clavicle, right? You can easily feel the clavicle, right? Now, remember, guys, it is the first bone to start ossifying. Just let me correct the spellings over here. Okay, it is the first bone to start ossifying. Okay, now remember, guys, when we talk about the ossifying part, remember the formation of bone, it is called as ossification. Formation of bone, it is called as ossification. Ossification. And it is the first bone to start ossifying, usually around 5 to 6 weeks. Okay, usually around 5 to 6 weeks, right? Now, can anyone tell me at which age the ossification will complete? Okay, this part I'll be discuss in like in the ossification also. Apart from that, remember that there is no medullary cavity over here. There is no medullary cavity over here, right? Remember, it is occasionally pierced by middle supraclavicular nerve. Yes, it is occasionally pierced by the middle supraclavicular nerve, right? So yes, these are the important peculiarities that you guys have to remember. I hope you might have read this earlier also, right? So yes. Hmm. Very good, Dimple D. It is 25 years age, 21 to 25. Yes, it is one of the peculiarities of the clavicle that you guys have to remember over here, right? Now coming on to the side determination, how to determine whether it is right or left clavicle. Yes, how to determine whether it is Navishri. Good evening, beta. Yes, just a moment, guys. I have an important call. I'll just get back to you. Just give me 1 minute. Meanwhile, you just copy this and I'll be back. Guys, are you able to hear me? Guys, am I audible, visible? Okay. I'm so sorry for the delay. Was some check. Am I visible, guys? Just give me a thumbs up if the audio and visuals are perfectly fine. Hmm. Check. Tick. Now, coming on to the side determination, guys. Coming on to the side determination, how to determine which is left and which is right. Yeah. Okay. Can anyone tell me how will you determine whether no, this is right or left clavicle? So guys, the very first point you have to see, that is the medial end of the clavicle. Okay, that is the medial end of the clavicle. Now when I say medial end, guys, it is almost circular or quadrangular in shape. Devang, okay, perfect. The medial end, it is almost circular circular or quadrangular in shape, right? It is the medial end. Firstly, you will find the medial end of the clavicle. It is circular or quadrangular in shape, right? Secondly, we have this, yes, the lateral end. Now, guys, you already know the lateral end of the clavicle or the acromial end, it is flat. Okay, the lateral or the acromial end, it is flat, right? The lateral or the acromial end, it is flat. Now, guys, just try to see the medial 3/5 over here. Now, after identifying the ends, now, guys, you have to see the medial 3/5. It is medial 3/5. And if you can just see, guys, the anterior part of the medial 3/5, it is convex. Convex, ये वाला part क्या होता है? This part, it is the convex वाला part. And where there is formation of a cave, it is concave. So remember the medial 3/5, anteriorly, it is convex, and posteriorly, it is concave. Remember this, very, very important, right? So remember the medial 3/5, anteriorly, it is convex, posteriorly, it is concave. Posteriorly, it is concave, right? Now, if we talk about the lateral 2/5, now just try to see the lateral 2/5 of the shaft. Okay, the medial 3/5 shaft, the lateral 2/5 anteriorly, बेटा ये cave जैसा बन रहा है, गुफा जैसा बन रहा है, so anteriorly it is concave, and posteriorly, lateral 2/5 shaft, it is convex, right? So remember the lateral 2/5 anteriorly, it is concave, and posteriorly, it is convex, right? So first you have decided the ends, then you have seen the shaft, right? Anteriorly, medial 3/5, it is convex, and anteriorly, lateral 2/5, it is concave. And after that, the point that is very much important and you have to keep in mind while locating the clavicle. Okay, lateral 2/5. Okay, guys, you can write it over here. Anteriorly, it is concave, and posteriorly, it is convex. Posteriorly, it is convex. After this, one important point that you have to see, that is the presence of subclavian groove. The presence of subclavian groove. Can anyone tell me in the chat box the subclavian groove is present on which uh, part, like the medial or lateral part, or on which surface it is present? Yes, anyone in the chat box? Because we have already discussed this. Yes. Hmm. Presence of the subclavian groove. It is present on which surface, guys? Remember, guys, subclavian groove, it is present on medial 3/5, okay, and on the inferior surface, right? It is present on the medial 3/5 of the shaft, right? And on which surface? That is inferior. So subclavian groove has to be located in such a way that it comes inferiorly, right? So it is the inferior surface. Yes, Mehfooz, good. Good, good, good. Hmm. So that was regarding the side determination. How can you define or like see whether the clavicle is right or left, right? So these are the 3, 4 points that you guys have to remember. All the points, the medial end, the lateral end, the medial 3/5 anteriorly and the lateral 2/5 anteriorly. You should know these are convex and concave, right? And the presence of the subclavian groove on the inferior surface of medial 3/5 shaft. Yes, very good, Shiv. Very good. Very good. Now coming on to the next part. Okay, coming on to the next part over here. Yes, the ossification of the clavicle. The ossification of the clavicle. Now remember guys, the clavicle, it is the first bone to be ossified. Okay. We have already discussed it is the first bone to be ossified, right? It is the first bone to be ossified, right? Now, remember guys, hmm, now, if you see the clavicle guys, the clavicle basically shows mixed ossification. The clavicle shows mixed ossification. It means that the clavicle is made up of the membranous part also. Okay, the membranous part also. And we have the cartilaginous part also, right? The cartilaginous ossification also. Now, if we talk about the membranous ossification, guys, right? The medial end, it basically ossifies in the membrane. Remember the medial end, which is quadrangular or circular in shape, it ossifies in the membrane, where the rest of the clavicle, it basically ossifies in the cartilage, right? So the rest of the clavicle, it ossifies in the cartilage, right? Now, there are only bone which is having two like centers in the shaft, right? It is the only bone which is having like two centers in the shaft, right? So remember, yeah. So if we talk about this shaft, right? So yes. So yes, we have two primary centers in the shaft, right? And it basically appears in the fifth to sixth intrauterine life. Fifth to sixth intrauterine life, right? It's the two primary centers which appear in the fifth to sixth intrauterine life, right? Right. Now the secondary center, basically for the medial end. For the medial end, the secondary center, it appears around 17 years of life. 17 years of life, and it basically fuses with the shaft. It fuses with the shaft around 21 to 22 years of life. 21 to 22 years of life, right? It fuses with the shaft around 21 to 22 years of life, right? So, yes. So you can see that the ossification has started around fifth to sixth intrauterine life when the no during the pregnancy, no when the embryo is developing. Initially up till 3 to 8 weeks we called embryo, right? Intrauterine life in the uterus when the no the baby is developing. Initially first 2 weeks is called as conceptus. Third week to eighth week it is called as embryo, and beyond eighth week, ninth week to 40 weeks of pregnancy it is called as fetus. So 5 to 6 week, you can imagine, guys, at this time, basically it is the embryo, right? And during that 5 to 6 week, these two primary centers are appearing and they both are growing, right? And the medial end, basically, it is the secondary center which appears later during the life when the person is 17 years of age. And approximately around 21 to 22 years of age, these two are fusing together, the shaft along with this medial end. So that's why, remember, guys, the clavicle is the weakest bone of the body. Okay, it is the most fractured, most commonly fractured bone of the body, and it is the weakest bone of the body as well, right? So that's why it's like the clavicular fractures are more common. Okay, so that is up till the ossification of the clavicle. I hope this is clear to everyone. Just give me a thumbs up in the chat box. Yes, if the ossification of the clavicle is clear. Sure. Khushi Goswami, Nikinder Reddy, Mohammad Siddiq, very good. Abhi, very good. Very good, guys. Nitin DK, Yana, very good. Hmm. Mehfooz, very good. Very good, beta. Sure. Next, let's start with the clinical anatomy of the clavicle. It's very important. Sai Krishna Dasari, very good. Shiv Kumar, very good, beta. Now let us start with the clinical anatomy, guys. Put $2 sign over here. It is very important. Out of clavicle, if you ask me in NEET PG, mostly these clinical anatomy questions will be there. Although you have to understand the site determination, the peculiarities, the ossification center, right? You have to go through like all the muscle attachments, right? All the important ligaments also I will talk in a while. But let us first talk about now the clinical anatomy of the clavicle. Sahil, Atharv, Ishita, very good. Chetan, okay, perfect. Now, firstly, let us start that what is the most common site of fracture of clavicle? Remember, the most common MC का मतलब वो नहीं है जो तुम लोग सोच रहे हो. It is basically most common site of fracture of clavicle. Remember, guys, सबसे common site क्या होता है? At the junction. Please update this point according to Gray's Anatomy. Earlier, the answer was different. Now, guys, the answer is different. Okay, at the junction of medial 3/5 and lateral 2/5 of the shaft. Lateral 2/5 of shaft. Remember, suppose this is the clavicle, right? And yes, this is the place where this is medial 3/5 and this is lateral 2/5. So at the junction of medial 3/5 and the lateral 2/5, this junction, okay, where you already know the why the fractures are most common over here, guys. You already know the medial 3/5, it is more or less cylindrical in shape, right? And lateral 2/5 is flat. So basically, there is a change of the shape. Can you see from 3D? Cylindrical is a 3D shape, and 2/5 is flat. It is most commonly like a 2D shape. And when there is change in configuration of the shape, this place is the most common site of fracture. It's the weakest point in the entire clavicle, right? Apart from that, another time the question has been asked that if suppose this is a clavicle, and if a clavicle is divided into three parts, we have proximal 1/3, we have middle 1/3, and we have lateral 1/3. Lateral 1/3. Now, out of these three, proximal 1/3, middle 1/3, and lateral 1/3, which is the most common site of fracture? Again, it is the middle 1/3. It is the most common site of fracture. It is not lateral. It is not proximal. It is the middle third of the clavicle, which is more common for fractures. Okay, which is more common for fractures, right? Right. So yes, that is status guys, you have to again remember. Now, if you can just see over here, right? Let us just try to look at this particular X-ray which is given over here. I'll come to all the images also. Red color. So this is the X-ray guys, which you can very well see that this is the cylindrical part, right? And this is the flat part, guys, right? So this is the fracture which you can see over here, the fracture of the right clavicle, the fracture of the right clavicle. And over here, you guys can very well assume that this fracture has resulted into a condition called as drooping of the shoulder. Very, very important. The fractures of clavicle can result into a condition called as the drooping of the shoulder. Kandha pura niche utar jata hai, that is called as the drooping of the shoulder. Guys, remember why it happens. Why it happens? Because you already know the medial 3/5, basically a muscle is attached on the superior surface. And this muscle on the medial 3/5, it is sternocleidomastoid muscle. Sternocleidomastoid muscle. Now, as soon as the fracture happens, this muscle takes the medial 3/5 of the clavicle up. Okay, due to the pull of the muscle, due to the pull of the sternocleidomastoid, this 3/5 part goes up, and on the right part, on the anterior border, you already know we have deltoid muscle. Now, due to the pull of the deltoid muscle, this lateral 2/5 come down, and in turn results in the drooping of the shoulder. In turn results in the drooping of the shoulder, right? So that is regarding one of the points in the clinical anatomy. I hope this is clear to everyone, right? What is the most common site of fracture in the clavicle, right? So yes, just give me a thumbs up, guys, if you know. Uh, hmm, sure. I hope this is clear. Now, second condition, guys, in the clinical anatomy only. We have discussed the first one. Khushi, very good. We have discussed the first one. Now we are coming on to the second most important condition in the clinical anatomy of the clavicle, and that is the yes, that is yes, Siddhan, Anjani, Yana, Satvik. Very good, very good. Second condition, it is the cleidocranial dystosis. Cleidocranial dysostosis. Cleidocranial dysostosis. Now, what does this mean? It means that it's a disease in which there is absence of clavicle. Absence of clavicle since birth. Okay, or it is congenitally. It just one mean the same thing. Congenital means by birth only. It is congenitally absent. It is congenitally absent. Absence of clavicle since birth, or it is congenitally absent, right? Absence of clavicle since birth, or it is congenitally absent, right? No clavicle. Okay, so you can just see even the drooping of the shoulder, guys, right? Even the drooping of the shoulder can be, no, you can see anteriorly, right? It is all the shoulders no have come anteriorly and they're down, okay, in front of the chest, right? So this can also result in the drooping of the shoulder, okay, the drooping of the shoulder, okay, where obviously it is approximated anteriorly, okay, it is approximated anteriorly in front of the chest. In front of the chest. In one time in the exam, they have not given this picture, they have given an X-ray also. Guys, in X-ray also, they have asked identify the condition below. So guys, you can very well see in the condition of that there is no clavicle, guys. If there is no clavicle, if you in the X-ray, if you don't see the clavicle, guys, obviously it will be cleidocranial dysostosis. Cleidocranial dysostosis, right? So I hope this is clear to everyone. चलो इतना क्लियर है सब लोगों को. So I hope these 2 points are very much clear regarding the clinical anatomy, the clavicular fracture and the absence of clavicle since birth. But before that, I just wanted to discuss something more. Yes, I wanted to discuss something more. Yes. Hmm. Now, one point that I wanted to discuss. Okay. Now, guys, you guys are going to tell me this is clavicle. Okay. I just want to see this is the medial end, right? Now you can see superiorly clavicle has no attachment, but superior, this is which part? Lateral two-fifth? Lateral two-fifth, which border it is? Anterior border. Can you name this muscle, guys? What is this muscle A? I want the answer in the chat box. What is this muscle A? And you can very well see the lateral two-fifth anterior border contains which muscle? Hmm. Very good, Siddhan Mansoori. It is the deltoid muscle, guys. Remember, lateral two-fifth anteriorly border जो है. Again, guys, just try to see over here. We have already discussed this. If you can see, two borders on the lateral two-fifth. An anterior border contains which muscle? Deltoid muscle. Very good. Shiv, Sai Krishna, Khushi, Mehfooz. Very good. It is the deltoid muscle. It is the deltoid muscle. Right, right. Mohammed Siddiq, very good. Nitin, very good. You have to identify the muscle as well. Now, guys, I have to talk about yes, some ligaments over here, right? Some ligaments over here. Yes. Hmm. Hmm. तनिष सात्विक इशिता वेरी गुड वेरी गुड अच्छा चल यहाँ पे ना कुछ लिगामेंट्स के बारे में डिस्कस करना है बेटा देयर इज समथिंग कॉल्ड एज इंटरक्लेविकुलर लिगामेंट अब देखो लिगामेंट का मतलब है इट विल ट्राई टू जॉइन टू बोन्स टुगेदर over here guys you can very well see we have the right clavicle and we have the left clavicle. Now anything which comes in between, it is called inter. Okay, it is between two clavicle. It is interclavicular ligament. Okay, the ligament which is connecting the right and the left clavicle. It is the interclavicular ligament. And remember, guys, it is the only ligament. Okay, remember, it is the only ligament which connects right upper limb and left upper limb. So you can see the peculiarity of this ligament also, that it is the only ligament which is connecting the right upper limb and the left upper limb together. Okay, right upper limb and the left upper limb. Left upper limb. Now, even that was regarding this. Now, even guys, we have already discussed that the medial end. If we talk about the medial end, guys, the medial end, it is forming a joint that is called as the sternoclavicular joint. Sternoclavicular joint. Now the ends of this medial margin, guys, be very clear with the statement. इसके जो ends होते हैं बेटा, the ends of this medial margin, okay, will give rise to, okay, it will give rise to fibrous capsule. Fibrous capsule. Now it is a ligamentous sheath which will now cover the sternoclavicular joint. Okay, the fibrous capsule, or I can say the yes, the capsular ligament, which is now covering the sternum also, the part of sternum also, and the medial end also. So it is the capsular ligament or the fibrous capsule. Okay. Hmm. So remember the medial end. I'm just writing it over here. The medial end, guys, remember the margin of articular surface basically gives attachment to Gives attachment to, firstly, you should know the fibrous capsule. Very, very important. Fibrous capsule, right? Also the articular disc, right? Articular disc which is posterior superiorly, पीछे की तरफ है और ऊपर की तरफ है, right? And also, just you can write one more thing over here. Fibrous capsule. Secondly, you can also mention it is giving rise to, yes, I'm writing it over here. Remember, articular disc, posterior superiorly, posterior superiorly, okay, and the interclavicular ligament. This is the medial margin which is now giving rise to, I mean, the ends of this medial margin, the medial end, the entire margin, the circular margin, it is giving rise to fibrous capsule, articular disc, and interclavicular ligament. Very, very important. Interclavicular ligament. That was the additional point that I wanted to add in this flowchart. Interclavicular ligament, right? So I hope this is clear, guys. I hope this is clear. So just give me a thumbs up in the chat box. Meanwhile, guys, just try to answer this question which is given over here, right? Yes, sure. Just let me know if you understood this. One of the clinical case study, a man had fall from a height and it is landed on an outstretched hand. The most common reason of clavicular fracture is no, like the patient has landed on an outstretched hand. The patient was about found to have the fracture. In the question only, they have given the diagnosis. Okay, they have given the diagnosis. This triangle in SIS is basically the symbol for diagnosis. Okay, what is the most common location of this fracture or where this fracture can be, right? So remember guys, it is the junction of medial 3/5 and, yes, hmm, and lateral 2/5. Yes, right. Mehfooz, very good beta. It is the junction of the medial 3/5. Nitik, Sadan, very good. Shiv, very good. Chaitanya, Sai Krishna, very good. It is the junction of medial 3/5 and lateral 2/5. Now the answer would not be this. This would not be the answer because it was an outdated information. Now the update has already been in Gray's Anatomy, so you have to follow the update as well. Second question. Again, this I have already discussed. A 18-year-old male presents with the complaint of pain, right? Pain over his left chest, right? He stated he was tackled while playing football and landed on his left shoulder. On examination, he has tenderness. Tenderness का मतलब होता है उस point पर अगर आप touch करोगे जहाँ पे patient को फ्रैक्चर है या पेन हो रहा है तो ही विल बर्स्ट आउट इन पेन गाइस, राइट? द पेशेंट विल कम एंड टेल यू कि सर यहाँ पर चोट लगी. ही विल ऑलवेज पॉइंट दैट पर्टिकुलर द अदर हैंड ऑन हिज एरिया where he got injured, and when you touch that with your own finger he will burst out in pain, and this is something called as tenderness, the point at which the patient is having pain, and the patient will burn out in like at most right over the left clavicle and is holding his left arm close to his body. X-ray reveals a fracture of the left clavicle. What segment of the clavicle is more prone to fracture, guys? Now, over here, the answer by Nitin, it is the middle third, guys. Very good, Nitin. It is the middle third, which is like more prone to the fracture, right? It is the middle third, which is more prone to the fracture. Very good. Hmm. Now, weight transmission from upper limb to axial skeleton is done by all except. Chalo. Khushi, Saddam, very good. Satvik, Shiv, Ishita, Chaitanya, very good. Now, the next question is weight transmission from the upper limb to axial skeleton is done by. Anyone? Sure. Now, guys, let us discuss about firstly coracoacromial ligament. Okay, let us first discuss because this question has it is a PYQ first. You should know it is a PYQ. PYQ basically stands for yes, the past year question, right? Previous year question or the past year question, right? You can just write like this. It is a previous year question. Previous year question, right? Okay. B, Satvik, Chaitanya, Khushi, Ishita, Shiv, Sadan. Okay, let us just try. It has asked all except. Let us first understand the concept. What is the weight transmission in upper limb? Weight transmission in upper limb. Now, guys, for example, if there is any weight you guys are carrying, for example, if there is any force or weight. Now, any weight, the first thing, if you're actually holding a phone in your hand, the first thing that will come, it is the hand only. So the weight that you will be like holding, it will be in the hand. Now from the hand, this will come into a joint called as the wrist joint. Okay, it will come into a joint called as the wrist joint. Right, from the hand, the weight will go to wrist joint. For example, if I'm holding a phone in my hand, the weight of the phone will be first to the hand and then to the wrist joint. Now from the wrist joint, it is actually the radiocarpal joint. It is the radiocarpal joint. So guys, just understand the weight will not go to ulna directly. The weight will first come to radius. The weight will first come to radius from the wrist joint, right? And from the wrist joint, okay, the weight will first come to the radius, and from the radius it will go to ulna. And from the radius it will go to which bone? Ulna. Ulna. Now from the ulna, guys, from the ulna forms the elbow joint, right? From the ulna, right? Now, how the basically the weight from the radius will come to ulna, guys? You already know that there is a ligament which is present in between the radius and ulna. This ligament, it is called as the interosseous ligament, interosseous ligament or interosseous membrane, interosseous ligament or the interosseous membrane, right? Interosseous ligament or interosseous membrane, and from the radius, basically the weight will go to ulna via the interosseous ligament, right? Now from the ulna, it will go to a joint called as the elbow joint. Okay, from the ulna, the weight will now go to elbow joint, elbow joint. Now from the elbow joint, guys, from the elbow joint, the weight will go to humerus. The weight will go to humerus, right? I hope till now it is clear. Now it is clear. We are holding the weight, right? We are holding the phone. It will go to hand first. Hand, then it will go to wrist joint. Wrist joint, it is the radiocarpal joint. Okay, it is between the radius and the carpal bone. So the weight from the wrist joint will go to radius. Then via interosseous ligament or membrane, it will go to ulna. From ulna, it forms a joint with the humerus called as the elbow joint, and via elbow joint to the humerus. And then guys, remember it will go to, yes, it will go to scapula. It will go to scapula via a joint that is called as the glenohumeral joint, glenohumeral joint, or the shoulder joint, or the shoulder joint, or the shoulder joint, right? Or the shoulder joint, right? It will go to the glenohumeral joint or the shoulder joint, right? Now, now you already know this is the weight has come to the scapula. Now, this is the acromion process of scapula. Acromion process of scapula. Now, from the acromion process, okay, okay, the weight has come into the scapula, or yes, this is the acromion process of the scapula. and this is the coracoid process. This is the coracoid process of scapula. Now, from the coracoid process, you can very well see we have a ligament called as coracoclavicular ligament. Coracoclavicular ligament. Now, from this coracoclavicular ligament, okay, from the glenoid cavity is coming into the scapula, okay, and from this joint, basically it is coming into the scapula, and from the scapula, we have the coracoclavicular ligament. From the coracoclavicular ligament, it is coming into clavicle. It is coming into clavicle, right? It is coming into clavicle, right? Now, after coming into the clavicle, guys, okay, after coming into the clavicle through this joint, that is the sternoclavicular joint, through this joint, that is the sternoclavicular joint, the weight will come into the sternum or the axial skeleton or the axial skeleton. Some amount of weight will also be transferred to the other clavicle via which ligament, guys? Some amount of weight. It is coming into the sternum. 90% will weight will go into the sternum, but 10% will go into the other clavicle. Can anyone tell me which ligament will be responsible for the transfer of weight from one clavicle to another? A small amount of weight also get transfers to the other clavicle, and which ligament is responsible for this? 90% weight sternum में आ जाता है, but कुछ amount of weight it also get transferred from one clavicle to other. अभी बताया था. Yes, it is very good. Sai Krishna Nikinda Reddy, very good beta. It is the interclavicular ligament. It is the interclavicular ligament. It is the interclavicular ligament. Basically, yes. Now let's come on to the question. The question says, weight transmission from upper limb to axial skeleton. Axial means the bones which are located in the center of the body or the midline or the medial plane of the body. It is done by all except. Now, okay, costoclavicular ligament. Okay, there is a ligament which is called as costoclavicular ligament. Okay, let's come to costoclavicular. Costo means, yes, we have this ligament between the costal rib and the clavicle. Costoclavicular ligament. Okay, again, yes कि हाँ थोड़ा amount of weight यार clavicle से rib तो axial skeleton का ही part है, तो clavicle से rib में ये costoclavicular ligament से भी आ सकता है weight. Costoclavicular ligament से भी आ सकता है weight. ओके, तो पहला ऑप्शन तो बिल्कुल ठीक है कि costoclavicular ligament can come. Coracoclavicular ligament, we have already discussed कि coracoclavicular ligament है क्योंकि it is from the coracoid process, it is going to the clavicle. Yes, it is helping in weight transmission. It is also correct. Coracoclavicular ligament. Interclavicular ligament, it means that there are two clavicles, right? The right and the left. And this interclavicular ligament is also responsible, right? The interclavicular ligament is also responsible. Now it is coracoacromial. It means in between the scapula only, guys. In between the scapula only. You can see the acromion process and the coracoid process. This ligament, is this helping in any weight transmission? No. From the coracoid process, the ligament is connected to acromion process. All the weight will come into the scapula only. Then what's the point of this ligament? From the coracoid process, the weight should go to clavicle. So coracoclavicular ligament is a part, but coracoacromial ligament will not help in any weight transmission. Okay, coracoid process and acromion both are parts of scapula only. So the weight will be interchanged in between the scapula only. So there is no point of like over here. So the answer over here will be the coracoacromial ligament, right? Coracoacromial ligament. It does not help in the weight transmission from the upper limb to the axial skeleton. It does not help in the weight transmission from the upper limb to the axial skeleton. Is it clear, everyone? Sure. फटाफट से एक thumbs up दे दो if it is clear to each and everyone over here. Hmm. Kushi, Sai Krishna. Hmm. चलो ठीक है. Very good. I hope the entire clavicle is clear to everyone. The entire clavicle is clear to everyone. Whatever clinical factors we have discussed, the peculiarities of the clavicle, the site determination, the ossification, the clinical anatomy, the X-ray, the clinical pictures, the clinical case study, the previous year question, and the weight transmission. It is clear to each one of you. I hope it's clear to each one of you. Let's start with the osteology of the scapula. Let's start with the osteology of the scapula. Right? Again, guys, please be with me. You have to know about each bone, everything, guys. I'll be discussing the muscle, ligaments, and joints within there and then only, right? So parts are important with the muscles, joints, and ligaments. They are very important, right? So yes, let us just try to discuss now. Yeah, the clavicle, and then we'll come to on through the muscle pictures also. No need to worry about that, right? Scapula. Now remember that scapula, it is a flat triangular bone. Okay, it is a flat triangular bone. Okay, it is the posterior bone of the shoulder girdle. It is the posterior bone of the shoulder girdle. It is the posterior bone of the shoulder girdle, also known as the shoulder blade. Let me just write it on the next point. It is also known as the shoulder blade. It is also known as the shoulder blade, right? Now, remember, guys, now to which rib it is present? It is one of the MCA question which has asked been previously. First, second, third, fourth, fifth, sixth, seventh, eighth. Now you can very well see it is present from second rib to seventh rib. Okay, it lies from second rib to seventh rib. It lies from second rib to seventh rib. It lies from second rib to seventh rib, right? It lies from yeah, second rib to the seventh rib. Now, let us just try to discuss more things, guys. You can very well assume that this is the head of the humerus, and this is the humerus. This is the humerus, and it forms a joint over here. This is called as the glenohumeral joint. Glenohumeral joint, okay, or the shoulder joint. Or the shoulder joint, right? Now, you can very well see that this bone, let us now discuss the parts of the clavicle, parts of the scapula. So guys, put the heading as the parts of the scapula. Guys, in one only, I will be discussing each and everything. So just try to make a flow chart. Okay, I will be discussing the muscles simultaneously, guys. I will be discussing the muscles simultaneously. Now, guys, first you have to see that this is the anterior view. This is the anterior view, right? The anterior view, guys, remember, it is like plane. It is just having a fossa over here, right? Remember, guys, this is the glenoid cavity. This is the glenoid cavity. Now, in the anterior view, guys, there are like one surface over here. This is one of the surface, guys, which you can see over here. This is called as the anterior surface. Okay, surface. The area will be large, guys. The area will be large. So remember, this is the yes, the anterior surface. So firstly, guys, you have to remember that there are two surfaces. There are two surfaces. Okay, we have first, yes. Firstly, remember we have the anterior surface, anterior surface. Now this anterior surface, guys, this anterior surface basically contains a fossa over here. Now, guys, remember this is a plane surface. If there is a very small depression over here, it will be called as fossa, right? A very, very small depression, right? So the anterior surface, basically, it is also called as. Now, if you just see the scapula, guys, स्कैपुला के आगे से बेटा आगे से क्या पास कर रही है रिब्स पास कर रही है स्कैपुला के आगे वाले सरफेस से रिब्स पास कर रही है स्कैपुला का दिस सरफेस व्हिच यू कैन सी ओवर हियर इट इज द पोस्टीरियर सरफेस ये पीछे वाला सरफेस होगा बट स्कैपुला का जो आगे वाला सरफेस है वहां से क्या पास कर रही है रिब्स और रिब्स को हम लोग क्या बोलते हैं रिब्स वी आल्सो कॉल्ड इट एज कोस्टल रिब्स राइट so the anterior surface it is also called as the coastal surface right? So the two surfaces, we have the anterior surface, also called as the coastal surface. And from this surface, what is passing the ribs? That's why the anterior surface is also called as coastal surface. And on this anterior surface, remember we have a fossa which is present, which is called as the subscapular fossa. We have a fossa that is present that is called as subscapular fossa. Fossa मतलब एक depression होता है. There is a small depression in the bone that is called as fossa, which you can very well see, right? Which you can very well see over here. There is a fossa over here, right? And to this fossa, guys, to this fossa, basically a muscle is present. A muscle is present, and that muscle it is called as subscapularis muscle. Very, very important. And to that muscle, at that fossa, a muscle is present that is called as subscapularis muscle. Subscapularis muscle, very, very important. Subscapularis muscle. Now, guys, let us just try to look at the subscapularis muscle. I hope I'm having the image with me. Okay, over here. Okay, I don't have that image, but remember, yes, we have don't have the subscapularis muscle. So remember that the subscapularis muscle it is basically present on the entire yes entire this anterior surface right? So yes, so you should know this is the subscapular fossa. Okay, this is the subscapular fossa, right? Okay, this is the subscapular fossa and this is the anterior surface, right? This is the anterior surface, right? Now we have another surface over here, guys. We have another surface over here. Let us just try to look at this posterior surface now. Now this entire posterior surface, you can very well see over here. This is the entire posterior surface. बेटा एरिया ज्यादा फ्लैट है आगे है तो पीछे भी होगा, सेम एरिया होगा. We have the same area in front also and at back also. So we have this posterior surface which is divided by spinous process. Spinous process. Process का मतलब होता है it is that part of the bone which is coming out, जो body से बाहर आ रहा है. For example, you have your own body and your upper limb is coming out. तो process का मतलब भी क्या होता है, टुकड़ा होता है एक bone का which is coming from the bone itself, right? From the bone itself. Yes, yes, Kafil Rahmani, I will be discussing the entire bone anatomy. No need to worry about that. Okay, I'll be conducting it on a daily basis. If I don't have like more classes, I'll be like sitting on the YouTube. Just promote my channel to everywhere you can. The more you will promote, the more love you will give me, the more videos I will post, and all free of cost. I will not charge anything and I'll complete the entire anatomy. Now we have the spinous process which divides the posterior surface into a small supra part and a big infra part. एक छोटा सा टुकड़ा ऊपर की तरफ आ रहा है और एक छोटा सा टुकड़ा नीचे की आ रहा है पोस्टीरियर सरफेस ही. So this is called as the supraspinous. Because supra means superior and it is above the spinous process, which is called as supraspinous part. And below we will have the infraspinous part. Infraspinous part. Now supraspinous part also contains a fossa. Okay, supraspinous part also contains a fossa. Let me just draw that fossa with a green color only. Okay, it contains a fossa. Okay, this is called as supraspinous fossa. Supraspinous fossa. And the infraspinous part will also contain a fossa, small depression, guys. That is called as the infraspinous fossa. Infraspinous fossa. Right? It also contains infraspinous fossa. Your way of teaching is just amazing, sir. All my friend loves your teaching style. Thank you so much, Kafil Rahmani. Please comment from which university you are. I will be happier to know this. Right? Now, supraspinous fossa, beta, it will contain a muscle. Now, the name itself suggests fossa है, यहाँ पर एक muscle present है. This muscle will be supraspinatus muscle. Supraspinatus muscle, one of the NEET PG question also. And we have a muscle in the infraspinous fossa also. That is called as the infraspinatus muscle. Infraspinatus muscle. Please be very clear with this. This is the infraspinatus muscle, right? Infraspinatus muscle. So let us just try to make this entire like posterior surface on one flow chart. Yeah. So we have two surfaces. Let us just try to discuss the other surface also. Okay, not here, not here, not here. We have, yes, the other surface. That is the posterior surface. Posterior surface, right? Now this posterior surface, remember guys, it is divided by which process? Spinous process. Okay, it is divided by spinous process. Please just try to make this a small flow chart over here, right? A small supraspinous part, right? A small supraspinous part and a big infraspinous part. Infraspinous part. A big infraspinous part. Now, a small supraspinous part It contains a fossa. Remember, it contains a fossa. That fossa, it is the supraspinous fossa. And it is the infraspinous fossa. Infraspinous fossa. Infraspinous fossa. The supraspinous fossa basically contains a muscle that is called as supraspinatus muscle. Very, very important. Supraspinatus muscle. And the infraspinous fossa contains infraspinatus muscle. Infraspinatus muscle. We have the supraspinatus muscle and we have the infraspinatus muscle. We have the supraspinatus muscle and the infraspinatus muscle. So we have two surface. Anterior surface, also known as the costal surface, because ribs are passing, so इसको costal surface भी बोलते हैं. It has a fossa called a subscapular fossa, and a muscle is attached over here. A muscle is originated that is called as the subscapularis muscle. Subscapularis muscle. The posterior surface, it is divided by the spinous process into a small subscapular supraspinous part above and a big infraspinous part below. Supraspinous part contains supraspinous fossa. Infraspinous part contains infraspinous fossa. Supraspinous fossa contains supraspinatus muscle. Infraspinous fossa contains infraspinatus muscle. Right? So I hope this is clear to everyone. I hope this is clear to everyone. Let us just try to look at the images of the muscle. Let us just try to look at the images of the muscle, right? I have the muscles over here. Now, guys, you can very well see how to determine the muscles now. This is the vertebra. This is the vertebra. Vertebra, when you can see, you can always assume that this is the posterior view. This is the posterior view, right? This is the posterior view, right? Now you can very well see beta की ये spinous process है. This is the spinous process and this is the acromion process. Right? We have the spinous process and acromion process. Spinous process के ऊपर muscle दिख रही है. Okay, spinous process के ऊपर muscle दिख रही है. You can very well assume ये कौन सी muscle होगी guys? Spinous process के ऊपर है. So this will be the supraspinatus muscle. Supraspinatus muscle. And the one which is below it is the infraspinatus muscle. Infraspinatus muscle. So you can very well see the posterior surface, it is divided by which process? Spinous process into a small supraspinous part above and a big infraspinatus part below. Supraspinous part contains supraspinous fossa, which contains supraspinatus muscle, and the infraspinous part contains the infraspinous fossa, which contains the infraspinatus muscle. Infraspinatus muscle, right? Sure. Now you guys can very well see that this supraspinatus muscle. Now guys, let me tell you one thing over here. If we talk about any muscle, guys, any muscle, let me just try to tell you that this like in between part, it is called as the belly of the muscle. It is called as the belly of the muscle. Okay, this is called as the belly of the muscle, right? There are two ends of the muscle. One it is called as origin and one it is called as insertion. One it is called as insertion. Now what is origin and what is insertion, guys? What is origin and what is insertion? Origin is that part of the muscle which is the muscle fibers are fixed. Muscle fibers are fixed. Okay, And remember that origin is always medial or proximal. Medial means it will be close to the midline of the body. Proximal means towards the center of the body or the one which comes first in the body. Proximal. Whereas when we say insertion, the muscle fibers are mobile. Muscle fibers are mobile. Mobile means they can move, and the insertion is always lateral, okay, or distal. The insertion is always lateral or distal. Now my question to everyone over here, that which part, okay, which part, the origin or the insertion, where the action of the muscle will be there? It will be at origin or it will be at insertion. Guys, just try to comment in the chat box just by using your common sense. Which part, origin or insertion, is the place where no the muscle will produce its action? Hmm. Very good, Jay. It is always the insertion beta, because remember the insertion fibers are the ones which are mobile. Origin की तो fibers ही fixed है. Origin fibers are already fixed. How the action will be produced? Now, yes, Nikendra Reddy, Sai Krishna, Shiv, Shelly, very good, very good. Insertion is the place where no the action of the muscle will be produced. Now, you can very well see over here, just let us figure it out over here in this picture only. You can see the supraspinatus. It is going below the acromion process to which bone? Humerus. Okay, it is going to which bone? That is humerus. The infraspinatus, it is going to which bone? It is also going to humerus. They both have the same like attachment on the humerus. Now they are from scapula. This is the scapula and they are going to humerus. Now if I ask you, what is the origin of supraspinatus muscle? Scapula or humerus? And what is and where will be the action produced? Chalo, Ishita very good, Chaitanya very good, Saddam very good, Kumar Abhishek very good, Mehfooz very good. Where will be the action produced? Hmm. On which bone the action will be produced? Sattvic meta, yes, humerus will be the one where will the action will be produced. What is the origin, guys, over here? Origin is always closer to the midline. Vertebra to midline mein hai na, vertebra is in the midline. So supraspinatus origin will be from the scapula. Insertion will be on the humerus. Insertion will be on the humerus. Yes, Jay, very good. Shiv, Shelly, Abhishek, Sai Krishna. Yes, very good, very good, very good. So I hope you guys can relate over here. Yes. Now, if you can see over here, guys. Now, if I ask you, what is the origin of supraspinatus muscle? Sadan, very good. Abhishek, very good. What is the origin of the supraspinatus muscle? You guys can very well relate. It is the supraspinous fossa on the posterior surface, right? So, yes, over here, remember the supraspinatus muscle, it is origin from the scapula. Infraspinatus muscle is also origin. Even the subscapularis muscle is also origin. Origin from the scapula. Origin from the scapula. Because scapula body के midline के ज़्यादा पास is compared to humerus, right? Let me just try to make one more picture over here, guys. Okay, yes. I hope you can very well see this is the scapula, guys, right? It's the supraspinous part, infraspinous part or fossa, right? Fossa, right? So basically, this scapula it is more closer to the midline. So supraspinatus muscle, infraspinatus muscle will be like originating from the scapula and will be inserting into which bone? Humerus. Inserting into which bone? That is the humerus, right? So that was regarding this bone. The two surfaces, guys. I hope this is clear. I hope this is clear to each one of you. चलो इतना क्लियर है सब लोगों को? बताओ जल्दी से. Discuss the two surfaces. Now we are going to discuss the three borders. The three borders. Itna clear hai? Just give me a thumbs up. Let's now discuss the three surfaces. The three borders, sorry. The three borders of the scapula. Siddharth, very good. The three borders of the scapula. मैं थोड़ा नीचे लिखता हूँ, otherwise it will be like. We are now going to discuss the three borders of the scapula. Okay, the three borders of the scapula. Siddiq, Shelly, Satvik, Nikender, very good. Abhi, very good. Okay, perfect. Shiv, very good. Now guys, what is the difference between surface and border? Surface में देखो एरिया बहुत ज्यादा होता है और बॉर्डर का मतलब क्या होता है? लाइन. बॉर्डर इज जस्ट अ लाइन. बॉर्डर इज जस्ट लाइक अ लाइन, है ना? एक लाइन की तरह होता है. Now this line, guys, now when I say scapula is a flat triangular bone, you can very well see that it will be having like three lines. One line you can see like this, one line you can see like this, and one line you can see like this, right? Right, so we have, it's a triangle. It will be formed from three lines. So we have like three borders over here. We have three borders, and muscle attachments on these borders are very, very important, right? Now remember guys, we have the glenoid cavity of the scapula. How to determine in the no scapula which one is which border? Now guys, if you just look at the picture over here, we have the glenoid cavity over here. We have the glenoid cavity. Let me just try to erase this so that you like. You guys are going to tell me this is the glenoid cavity, right? This is glenoid cavity. Now glenoid cavity is lateral or it's medial? You guys tell me in the chat box. Glenoid cavity is lateral or medial? Now guys, you already know this is the vertebra. Anything which is closer to the vertebra or closer to the midline of the body, it is said to be medial. Okay, so we have medial, this जो medial के पास है. So glenoid cavity, it is always medially or laterally located? Sai Krishna Desari, very good beta. Glenoid cavity is always lateral. Glenoid cavity is always lateral. So you guys can easily figure out कि ये वाला जो border होगा, okay, which border it will be, guys? Tell me. This A will be which border, guys? Which is just next to glenoid cavity. Yes, Satvik, Dimple, Jay, Shelly, Shiv, very good. And what will be this border called as? Which is located just near to the vertebra. Just near to the vertebra. Yes, Siddiq, very good, Shiv. Hmm. ये कौन सा border है? So I think it is very clear. The one which is next to the glenoid cavity, if you just see the scapula also, yes, Jayvarad, very good. Shiv Kumar, Dimple D, very good. It is the lateral border of the scapula. And B will be the medial border of the scapula. B will be the medial border of the scapula, right? Hmm. हाँ 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 ठीक ठीक, everyone is right. Tikender, Kumar, Kafil, very good. Hmm. And the one which is above will be the superior border. So we have like three borders, the medial, lateral, and yes. So Let us just try to look at this. So first we are going to discuss the medial border of the scapula. The medial border of the scapula. Remember this one, it is the medial border of the scapula. The medial border, it is the longest border of the scapula. देखो glenoid cavity के नीचे वाला border कौन सा हो जाएगा? This will be the lateral border. Lateral border. और जो सबसे बड़ा वाला बॉर्डर है अपोजिट वाला मीडियल हो जाएगा और ऊपर वाला क्या हो जाएगा? सुपीरियर बॉर्डर. Superior border. So we have the medial border, we have the lateral border, and we also have the superior border of the scapula. We also have the superior border of the scapula, right? So remember the medial border, it is the longest border of the scapula. It is the longest border of the scapula. It is the longest border of the scapula. Now this medial border, guys, you can very well see over here. Let us just try to focus some important points over here. This is the anterior view. This is the anterior view. Now when I say medial border, guys, okay, the medial border which is closer to the midline, it's just a line. It's just a line. Okay, I'm not talking about the surface. I'm just talking about the line, the border. India has a great land surface. Pakistan also has a great land surface. In between, we have the Indian-Pakistan border. Okay, now that border is just like a line, right? Just like a line, just like a gateway. Now this medial border will have two views, guys. You can see the medial border from front also. And remember, guys, you can see the medial border. You can very well assume that beta, this is the posterior surface. This is the posterior view, right? This is the spinous process. This is the acromion process. I hope you can very well see wherever the spinous process is present, it is the posterior part only. It is the posterior part only. Now you can very well see this is the glenoid cavity. So this one will be the lateral border. The shortest one will be the superior border, and the longest one will be the medial border. The longest one will be the medial border. The longest one will be the medial border, right? Now, guys, you can see the medial border from anterior also, right? From in the anterior view also. You can see the medial border from posterior view also. Border is same, but we have two different views. We can see from front also this border, and we can see from back also. So the medial border has two lips. Remember, guys, the medial border has two lips. The medial border has two lips. Now we have two lips of the medial border, right? We have the anterior lip of the medial border. Anterior lip, this lip. This is the anterior lip of the medial border. In the anterior view, you can see the anterior lip. And we have the posterior lip of the medial border. The posterior lip of the medial border. So this is the posterior lip, right? This is the posterior lip of the medial border. Now let us just try to figure out the muscle attachments. In the anterior lip, guys, in the anterior lip, basically a muscle is attached over here that is called as serratus anterior muscle. Very, very important. Serratus anterior muscle. Serratus anterior muscle. Now, when I say serratus anterior, guys, naam dekho serratus. Serratus means it has crisscross like uh, fibers. Serratus anterior muscle. It has crisscross like fibers. Now, this muscle basically it originates from the first 8 ribs. You guys should remember this originates from first 8 ribs. पहली जो 8 रिब्स है, फर्स्ट सेकंड थर्ड फोर्थ फिफ्थ सिक्स सेवंथ एट, फर्स्ट 8 रिब्स से origin करता है. It originates from the first 8 ribs and it inserts into the anterior lip of the medial border of the scapula. So serratus anterior muscle, over here in scapula it is insertion. In scapula it is insertion. Very very important. Origin करता है पहली 8 ribs से, और ये इंसर्ट कहाँ होता है? स्कैपुला के मीडियल बॉर्डर पे. और मीडियल बॉर्डर का कौन सा लिप है? इट इज द एंटीरियर लिप ऑफ द मीडियल बॉर्डर. तो इस पूरे पर एक मसल ही अटैच होती है, एंड दैट इज कॉल्ड एज द सेरेटस एंटीरियर मसल. इट इज द सेरेटस एंटीरियर मसल. इज इट क्लियर एवरीवन? जस्ट गिव मी अ थम्स अप इफ दिस पोर्शन इज क्लियर. महफूज एंजल वेरी गुड. शैली डिंपल खुशी निकिंदर वेरी गुड वेरी गुड वेरी गुड गाइस. नाउ अभी नितिन अर्चना शिव सदान सिद्दीक करिमा सात्विक वेरी गुड वेरी गुड. Now posterior lip guys, posterior lip. Now let us discuss regarding the posterior lip. Now if you can see, this is the posterior lip, right? This is the spinous process. This is the spinous process. Vaibhav, very good. Sharma, Chaitanya, Akshay, very good. Now you can see that this is the spinous process. This part, it is called as the apex of spinous process. It is called as apex of the spinous process. We have a part above the apex of the spinous process, and we have the part below the apex of the spinous process. देखो स्पाइनस प्रोसेस जहां से शुरू हो रही है उस पार्ट को क्या बोलते हैं? एपेक्स. ठीक है. एक पार्ट मीडियल बॉर्डर का ऊपर है और एक पार्ट एपेक्स के नीचे है. तो द मीडियल बॉर्डर posterior lip, it is divided into 3 parts, right? Apex, above the apex, ये ऊपर वाला पार्ट हो गया above the apex, and one it is below the apex, एक नीचे वाला पार्ट हो गया below the apex of the spinous process, below the apex of the spinous process, right? So guys, just first try to mention this in your notes that the posterior lip, it is having 3 parts, right? It is having 3 parts. Okay, so we have at apex of spinous, apex means tip also, apex of spinous process, we have above the apex, and we have below the apex, below the apex of the spinous process. We have above the apex and we have below the apex of the spinous process. तो posterior lip को posterior lip को देखो बॉर्डर मीडियल ही है, पीछे की तरफ वाला posterior lip हो गया, और इसको 3 पार्ट्स में डिवाइड किया, एपेक्स, एपेक्स के ऊपर और एपेक्स के नीचे, एपेक्स के ऊपर और एपेक्स के नीचे, right? So we have like 3 different muscular attachments over here. We have 3 different muscular attachments over here. Let us just try to focus over here guys. एपेक्स पर एक मसल अटैच होती है. रिमेंबर, एपेक्स पर एक मसल अटैच होती है, दैट इज कॉल्ड एज रोम्बॉइड माइनर, रोम्बॉइड माइनर मसल. एपेक्स के पूरा का पूरा नीचे एक मसल अटैच होती है जिसको बोलते हैं रोम्बॉइड मेजर मसल, रोम्बॉइड मेजर मसल. और एपेक्स के ऊपर एक मसल अटैच होती है जिसको बोलते हैं लिवेटर स्कैपुले मसल, लिवेटर स्कैपुले मसल। एपेक्स पर रोम्बॉइड माइनर, एपेक्स के नीचे रोम्बॉइड मेजर और एपेक्स के ऊपर लिवेटर स्कैपुले मसल, लिवेटर स्कैपुले मसल. Now let us just try to mention this in our notes. Above the apex we have levator scapulae muscle, levator scapulae muscle. Okay, levator scapulae muscle. At the apex we have rhomboid minor muscle. Below the apex we have rhomboid major muscle. Below the apex we have rhomboid major muscle. Okay, so at the apex we have rhomboid minor, below the apex rhomboid major, and above the apex we have levator scapulae. Above the apex we have levator scapulae. Now, now guys, just try to look at this picture, everyone. Now you can very well see this is spinous process. This is the acromion process. This is the apex. This is the apex. Can you tell me which muscle is A, which muscle is B, and which muscle is C? And this entirely, guys, it is which border? Medial border. Obviously, it is closer to the midline. It is the longest border, right? It is closer to the vertebra. That's why we have the medial border. We have the lateral border over here, right? So the medial border, we have apex, yes, of the spinous process. You can see. So can you name these three muscles? Dimple D, yeah, A is rhomboid minor beta. We very clear it is the rhomboid minor muscle. B, it is the rhomboid major muscle. And C, it is levator scapulae. Very good. Levator scapulae muscle. Now my question is rhomboid minor, rhomboid major, levator scapulae. Okay, rhomboid minor, major, levator scapulae, they are coming from vertebra. They are coming from vertebra. You guys are going to tell me, and they are coming to which bone? Scapula. You guys are going to tell me rhomboid minor, rhomboid major, levator scapulae, which one is the origin and which one is the insertion? Scapula is the origin or vertebra is the insertion or vice versa? Just tell me in the comment section. Yes, Sai Krishna, very good. Dimple T, very good. Shiv Kumar, very good. Very good. मुझे अब ये बताओ वर्टिब्रा और स्कैपुला में से origin क्या है और insertion क्या है? What is the origin and what is the insertion? अरे नहीं नहीं, डिम्पल आई एम जस्ट आस्किंग वर्टिब्रा और फर्स्ट एड ट्रिप्स कहाँ से आ गई? वर्टिब्रा से मसल आ रही है. यस. साई कृष्णा, ओके. बेटा रिमेंबर वर्टिब्रा से रोम्बॉइड माइनर आ रही है ना. वर्टिब्रा इज इन द मिड लाइन. वर्टिब्रा मिड लाइन में है. एनीथिंग विच इज मीडियल इट इज ऑलवेज ऑरिजिन. Yes, Archana, very good. Nikinder, very good. Origin is vertebra. Yes. नितिन निकिंदर वेरी गुड. इंसर्शन इज स्कैपुला गाइस. इंसर्शन देखो, बॉडी में मीडियल क्या है? वर्टिब्रा ही है. बॉडी में मीडियल क्या है? वर्टिब्रा ही है. और बॉडी में इंसर्ट कहाँ पे हो रही है? स्कैपुला पे। इस ऑरिजिन वर्टिब्रा इंसर्शन स्कैपुला। सिद्दीक वेरी गुड वेरी गुड। हाँ। हम्म। आई थिंक यू कैन अंडरस्टैंड बेटा, जो भी मसल के फाइबर अगर बॉडी के मिड लाइन के पास है, अगर इफ द फाइबर्स ऑफ द मसल आर क्लोजर टू द मिड लाइन ऑफ द बॉडी, vertebra is in the midline only. So the rhomboid minor origin will be vertebra, insertion will be scapula. I will be discussing the muscles after this of the upper limb, but you should have the basic idea कि origin किस bone से है और insertion किस bone पे है, because you just have to use your brain over here. I've already told origin is always medial, insertion is always lateral. तो vertebra तो है ही midline में. So basically the origin will be rhomboid minor, rhomboid major, levator scapula is vertebra only. Insertion will be what? Scapula. Oh, scapula, right? Yes, Shiv, very good. Abhi, very good. Siddhant, very good. So you can very well see over here also. Hmm. Please mention these. These are all insertions. These are all insertion. These are all insertion, guys. These are all insertion, right? Levator scapulae, rhomboid minor, rhomboid major. These are all insertion. I hope this you understood. Key scapula pe insertion. So we have discussed two surfaces. Okay, we have discussed two surfaces, guys. The anterior surface, the posterior surface. We have discussed one border only. That is the medial border. That is the medial border. And medial border has two lips: anterior lip and posterior lip. Anterior lip also discussed. Posterior lip also discussed. Rest, I think we should continue tomorrow. Okay, rest we should continue tomorrow, guys. Right? So yes, let's meet tomorrow. Anyone who just have any doubts can connect to me on Instagram. Notes I will update tomorrow on the Telegram when I will complete the scapula. Okay, so you can join my Telegram ID, that is Talks Mayan. This is my WhatsApp contact if you have any doubt, and this is my Insta ID. If I don't reply on WhatsApp, you can connect to me on Instagram. Definitely on Instagram, I will reply you. Right? So share the video as much as you can. Please try to leave a feedback in the comment section below, right? And share this with your juniors, right? I want maximum students to watch this. Later, this is just the starting. I've just started with the series. I will be completing it, right? So yes, thank you so much. We'll be completing it tomorrow now.